Perimenopause, almost. We're almost there, I promise. I want to talk about labs real quick first. So far too many women have been told that there are no labs for perimenopause, when in fact there are. There's no one single lab that is true. There are a combination of labs looking at all of the hormones, not just female hormones, but thyroid and adrenal hormones as well. So yes, there are labs that can be done, and if you know when to get those labs drawn, if you know how to interpret those labs, look at those ratios in those hormones, then yeah, we can actually tell from lab work whether or not you're in perimenopause. So as a good visual, this is, I know it's backwards in the video, I apologize, but this is what our hormones are doing during the normal cycle. As you can see during the follicular phase, that blue line, estrogen rising until the egg is released from the follicle, then the follicle starts producing more progesterone, and so we have more of that. As you can see, when we test our hormones matters. And so if you get your labs taken here at the beginning of the cycle, they're going to look bottomed out. Of course they are. If you're going to get them here right about ovulation time, it's going to look like estrogen dominance. Of course it is, because it is. If you get them drawn here, though, in that last luteal phase around day 21, this is an ideal time to get those labs drawn, because this is where progesterone should be at its highest. So we're not thinking it's low because we got it drawn over here. No, this is where we want it to be. If it's low here, we know there's a problem. And estrogen, while not at its highest, has a ratio from progesterone to estrogen, and we can measure this. And so that's why getting our labs drawn here in that luteal phase around day 21 is so incredibly important. Now, there's a couple ways you can do the timing of that. Some women have no problem measuring their cervical mucus, that cervical mucus being part of ovulation, and then counting from there about when they're halfway between ovulation and menses. That can be icky, that can be gross, that can just be something we don't want to pay attention to, we can lose track of it too. I personally don't like to do that. So we make a calendar guess around day 21. So when did your last period start? Count 21 days out, that's when we're going to do the labs. That can be a great, oh, that was so close, Jen, I hope you cut this part out because I have something else to say. I would like to add a little PS to this statement too. If your doctor is saying, fine, I'll order your hormones, but they aren't giving you a time frame of your cycle when you should be getting them drawn, or you've got them drawn somewhere else and you're bringing them in and your doctor doesn't ask, where were you at in your cycle when these were drawn? I wouldn't put too much hope into that appointment. Just saying.